Good morning. My name is Alexis Topchin, and welcome to our webinar where we'll cover the American Heart Association and the American Academy of Pediatrics focused update on drowning. It was amazing to see the world cloud populate with the cities where our audience members are located, not only in the US, but also internationally. It's a momentous day as we mark the publication of this joint focused update from the AHA and the AAP. I am honored to have served as a senior author on this focused update. We had a wide range of experts, including international representation, that came together to develop this focused update. We thank them for their contribution. On behalf of the writing group, Dr. Desfoulian and Dr. McCallan, our co-chairs, who you'll hear from shortly, we thank you for joining us for this webinar today. This new released scientific paper contains updated CPR guidance to improve survival for the special situation of resuscitation following drowning. The paper is also an update to the AHA guidelines for CPR and ECC for the special circumstance of resuscitation following drowning. Drowning is the third leading cause of death from unintentional injury worldwide, accounting for 7% of all injury-related deaths. The World Health Organization estimates that 236,000 deaths are due to drowning worldwide each year. While this is a grim number, I want to also emphasize that drowning is preventable. Do you know the percentage of drownings that are estimated to be preventable? Take this poll that is up right now to submit your answer. During this webinar, you'll hear from the Focus Update co-chairs, Cameron Desfoulian, Senior Faculty in Pediatrics at Baylor College of Medicine, and Dr. Tracy McCallan, an Associate Professor of Pediatrics in the Division of Emergency Medicine at Rainbow Babies and Children's Hospital. An overview of the updated and new recommendations will be covered, and drowning prevention and the drowning chain of survival will be discussed. There will also be 2 question and answer sessions. During the first Q&A, I'll ask Cameron and Tracy some questions that I've prepared. Then, towards the end of the program, Cameron and Tracy will answer questions that we received from the audience. We encourage you to submit your questions throughout the program by following the instructions that are appearing in the banner on the bottom right now at the bottom of the screen. The banner will also appear at other times throughout the program to remind you to submit your questions. A few moments ago, we put that poll up asking you if you knew the percentage of drownings that are estimated to be preventable. Let's take a look at that now. We can see that most answered more than 90%, and that is 100% correct. More than 90% of drownings are thought to be preventable. So to begin our program, we will first hear from a mother and her 2 teenage daughters who helped save the life of a child when he had a cardiac arrest due to drowning last summer at a community swimming pool in Texas. I want to both thank and welcome Lupe Arias and her 2 teenage daughters, Diana and Kaylee, who are joining us today to share what happened.
Hello, good morning, everybody.
Hi, good morning.
So on last summer, we were at our community pool, and we were having a good day with our family, like usual. It was a full pool, and my 2 daughters just saw a boy under the water. They took quick action and took the boy out of the pool and screamed for help. That day we were having a good time with our family, and we were about to leave. My daughter, that's 5 years old, she told us to stay for about 5 more minutes, so we were like, yeah, that's fine, we're gonna stay for 5 more minutes. And that's when everything happened. I feel that everything happens at the right time, so we were there to help the boy out. My 2 daughters, Kaylee, that's right here, and Diana, we were able to help.
Everything happened like really fast. Several people were calling 911. Like you had like whenever we had just seen the boy, like I felt like everybody would just honestly really go into panic. So we pulled out the kid and everybody started calling 911. And my first instinct was call my dad. So he was there, and once I called my dad, he started giving CPR like very fast. My dad took action very fast. And honestly, all that was in my mind was like, what if that was one of my siblings? So it would be like, so I had to take, like, we had to take action really fast. So the kid wouldn't like, like nothing bad would have happened to him. And at first, the boy wasn't responding at all. When we first took him out of the pool, we don't really know how long he was there for, but he wasn't responding. My dad started doing mouth to mouth and was like, "Oh, like whose kid is this?" And finally, the mom showed up, and he started doing the breaths while the mom was doing mouth to mouth.
Okay. And before all of that, we were just, in the pool like anybody else. And when we seen him, we were like, is that a kid? We were like kind of suspicious if it was somebody or not. And I told my sister, I was like, look, like is that somebody or no? And then my sister was like, hold on, let's see. And then we both pulled him up, and we were like, is he playing? Like she said, is he playing? And then he wasn't responding. And then we saw the foam coming out of his nose, and that's whenever we were like, okay, like we gotta act. And then my sister, she did what she had to do. And she called my dad. She acted really fast. She asked for help. And while my dad and whenever we had both pulled them up, then after we were, I was trying to ask who was the mom, because like nobody was really responding. So I was like, kind of like, where is she? And then we finally found her. And by then my dad and everybody, well, my dad, my sister, they were doing the CPR, and that's whenever he kind of responded. Yeah.
That was an incredibly powerful story that we just heard from Lupe, Diana, and Kaylee. It is truly a testament to the chain of survival and how the quick actions of several people can really contribute to saving a life. Now we'll hear from one of our Focus Update co-chairs, Cameron Desfoulian, as he provides an overview of drowning in adults and children. Then he'll discuss the update and new recommendations and the focused update on drowning.
So thank you, Alexis. To go over the recommendations for drowning adults, I think it's important first that we understand that drowning is a minority of cases that actually require resuscitation. So most drowning is preventable, and we'll be discussing that. But it's important that in these cases where resuscitation is in fact required, that's where you have the majority of the deaths and the organ injuries. So for that reason, it's crucial to understand what to do about it. The total numbers are about 4,000 annually in the US, but it's 236,000 worldwide. So this is really a bigger global problem than it is in this country. And in the situation of drowning, which really is a special circumstance of cardiac arrest, the standard basic life support guidelines that we have for CPR need some modification, which was the purpose of this drowning update. We took the prior AHA guidelines, which were for basic life support, and then looked at all of them with the idea of what potentially needed modification for application to drowning. There were several important questions that actually have come up in the field of drowning resuscitation that have not previously been addressed in prior AHA recommendations. And these were the subject of some of the ILCOR recommendations from 2022 and 2023. And so we took those up as a committee and discussed how we would make recommendations. Those recommendations in total that are aimed for adults as well as children in drowning are published in Circulation with a simultaneous article going in Pediatrics. My colleague Tracy McCallum, my co-chair, will actually be discussing the pediatric guidelines.
Thank you, Cameron. This was a really exciting opportunity for us since the AHA has previously collaborated with the AAP on neonatal guidelines, but this was the first time that the two organizations collaborated on drowning. And it's especially important because drowning disproportionately affects children, and this was a really great opportunity for us to collaborate. We previously have an AAP policy statement and technical report that were last published in 2019 and 2021, which are undergoing revision at this time for our updated versions. And these focus mainly on prevention as well as advocacy opportunities. The AHA, BLS, and PALS guidelines on resuscitation have previously been utilized, but not necessarily drowning specific. So this focused update really provided that additional guidance. Another really good opportunity with this review is that we had a chance to look at specifically pediatric literature compared to the adult literature. And therefore we have two separate manuscripts, one in pediatrics that focuses on the pediatric literature, and then in circulation, which focuses on both the adult and pediatric populations. At the outset of this writing group, it was unclear whether we would find different recommendations for the pediatric or adult population. And we did ultimately find that the recommendations are very similar across those populations. But another opportunity for having the separate publications is that we in pediatrics could have a very broad reach to a largely pediatrician audience that had not previously been targeted with resuscitation-based publication. So an overview of the recommendations in this focused update include two updated and reaffirmed recommendations that had existed previously on in-water rescue breathing, as well as CPR and cardiac arrest following drowning. And some new recommendations include oxygen administration, PAD programs or public access defibrillation, AED or automated external defibrillator use after CPR initiation, and pre-hospital ventilation with or without equipment for trained rescuers. I'll turn it over to Cameron to go through these recommendations in more detail.
Thank you, Tracy. And so I think one of the things to emphasize here is that our definition of training and a trained rescuer in these drowning resuscitation guidelines differs from what is standard within other American Heart Association CPR guidelines. Typically, a healthcare provider like myself or Alexis or Tracy would be considered a trained rescuer. However, in the setting of an aquatic environment, some of the trained rescuers are folks like lifeguards or swim instructors, and they have a different skill set than somebody who's a healthcare worker or with emergency medical services. And so in that regard, it's important that for skills such as in-water rescue breathing, it be practiced by somebody who has the training for that. So that would not be something that, for example, a healthcare provider like myself, who's not a lifeguard, would be attempting because of the fact that doing so actually puts you at danger. And part of our goal in drowning resuscitation is to avoid having the rescuer become another victim. Now, admittedly, this may delay the time in which resuscitation can begin. And that can be really agonizing, but unfortunately, that's ultimately going to lead to the least number of victims within this kind of situation. In the case that we heard from the RES family, obviously the child was in the pool and it was a safe environment for them to dive in. So that's actually an excellent example of where drowning resuscitation can be rapidly executed and done safely to rescue the particular victim out of the scenario of being in the water. So going through our recommendations, The first related to oxygen, and there it's important to realize that most cardiac arrests that are happening in drowning are from a lack of oxygen, and therefore the administration of oxygen was felt to be something that was important, and to the best evidence that we had, it's considered to be something helpful. Now, oxygen is not always readily available at the scene when you're resuscitating a drowning patient, and so in that situation, you really should not delay starting CPR with compressions and with rescue breaths just to find oxygen. And indeed, in the example that you heard again from the RS family, resuscitation was the first thing that was done, and that's exactly what's appropriate. And when oxygen arrives on the scene, for example, through EMS, then it can be administered. Next, moving on to the fact that drowning is a form of respiratory arrest preceding cardiac arrest, again, in most cases. The use of certain adjuncts to help with airway and breathing makes sense. And in fact, prioritizing airway and breathing is something that's different than the traditional CPR guidelines, where particularly for adults, we're emphasizing chest compressions. But in drowning populations, airway and breathing before circulation is something that is an option, particularly for trained rescuers who know how to manage an airway, know how to administer breaths. And there, what needs to be considered is just that you're not going to delay the resuscitation. So again, we want resuscitation to be as quick as possible, but we want to understand that good ventilations or breaths are important. And so if administering them up front can be done quickly, that should be prioritized. If the use of equipment such as a supraglottic airway or bag valve mask ventilation can be done quickly, that also should be considered as an adjunct. Our next set of recommendations were around the subject of public access defibrillation and the use of automated external defibrillators. So public access defibrillators are meant for shockable rhythms, and shockable rhythms, in fact, do constitute a minority of the cases in drowning. Between different papers that we looked at, that number varied from 2 to 12%. However, it should be emphasized that those events, which might be actually a cardiac event happening in water, for example, someone swimming and then having a heart attack while in the water and therefore becoming a drowning victim, those particular forms of arrest have some of the best outcomes. And for that reason, defibrillation is something important that should be prioritized. So AEDs should be placed in areas where there are crowds of folks participating in aquatic activities, recognizing that aquatic activities are stressful. They're a form of exercise and in fact may lead to some people having cardiac arrest. And then those AEDs should be employed as quickly as possible, because when they are quickly employed and defibrillation is rapid, you get the best outcomes. But again, we want to emphasize that although AEDs are safe and they should be utilized, they should never be prioritized over CPR with breaths. That's still the most important feature and the first thing that you should do in a drowning resuscitation. So with that, I'm going to turn it back to Tracy and Alexis to talk to us about some of the questions and some of the other aspects of prevention in drowning.
Thanks, Cameron and Tracy, for the update on the guidelines. I think it would be really helpful for the audience to understand how they should respond based on different scenarios that they may encounter in light of the guidance you just covered. I have a couple of questions that I'd like to pose to you, so you can highlight, some specific scenarios. So, Cameron, for you first. Let's say an individual is at the beach on a day where there are huge waves hitting the shoreline. They notice somebody who's about 100 yards out of the water who is unresponsive, or someone who needs help. How should this person proceed?
Yeah, I mean, I think that's a great question. And there, obviously, I think any of us who see that want to jump in and try to rescue the person who's out there. But that is, in most situations, the wrong idea. I think unless you really are a skilled swimmer and rescuer, you're somebody who has lifeguard training and can handle that kind of environment, you don't want to add yourself to being one of the victims that's out there in the water drowning. And so in that situation, calling an emergency response, in this country, that would be 911, and getting help as quickly as possible, if there is a lifeguard around that you can notify, is the right way to go to try to safely rescue the person who is drowning. Great,
thank you. That's really helpful. I want to shift gears a little bit. Tracy, this one's for you. So a slightly different scenario. An individual's at a pool party at a friend's house. They turn around and look and they see that there's someone at the bottom of the pool. What should that person do?
That's a great question, Alexis, and I think really highlights the situation that the family shared for the child that they were able to rescue and resuscitate. So it can be very difficult to identify drowning, as you heard them describe. There's a lot of people in the water, and drowning does not look like it is typically portrayed in the media. So the body responses to drowning are to try to lift the head and face out of the water to prioritize breathing. So a person who is drowning is really incapable of yelling or calling for help or waving their arms or lifting them around to signal the event. So this is contrary to what we typically see in media or movies. So when a person is drowning, you'll often see them kind of bobbing at the surface of the water and then slipping underneath, and it often can be very quick and quiet. So if someone is identified at the bottom of the pool, whoever is potentially the closest person that could remove them from the water to be able to get them to the side of the pool where CPR could begin would be ideal. If no one is in the water, then the person, who jumps in to rescue would ideally have swim skills. As Cameron mentioned, we really want to make sure the rescuers are being safe as well, because there have been some very tragic incidences where a rescuer became a second victim of drowning because they didn't have those skills. So then getting the person to the side of the pool on a flat surface where CPR can begin is very important. And in a setting like around the pool, there may be a lot of other people available. So utilizing those around you, having someone call 911, someone else can go to look for an AED while CPR is beginning with the rescue breaths and compression. So really, using that team effort, if you have those people available, can help to shave off really crucial time when we're trying to have the best possible outcomes after a drowning event.
Great, thanks, Tracy. I think in follow-up, I just want to ask, as after experiencing an event like that, what are some important steps that a layperson should do between sort of the time that's happened and in the week after, as they sort of reflect upon that?
Thanks, Alexis. That's another great question. So something everybody can do is, talk to your family, talk to friends, and find out who is already trained in CPR. And if people are not trained, really trying to seek out courses, look at what is available locally to you and take a course, become CPR trained. The other thing that people can do, which is very quick and easy, is just start by surveying your home. Take a walk around, see what potential water risks exist. So knowing that children, infants and small children can drown in as little as 2 inches of water, identifying anywhere that standing water could exist. So sinks, tubs or buckets, making sure the bathtub is not filled higher than those 2 inches with small children, toilets. Those are all household locations where children have been known to drown. And then looking outside the home, is there a pool in the backyard? The most proven way to prevent drowning is a 4-sided isolation fence or barrier all the way around that pool to prevent children from having unanticipated access to that water. So seeing, what water exists, what barriers are in place or not in place, and may identify some opportunities that you could take to better, safeguard your home against drowning.
Thanks, Tracy. I mean, it really sounds like this is a ton of prevention. And as we talked about earlier, since 90% of drownings are preventable, really focusing on how to implement preventative strategies is really important. Cameron, I have another question for you. I think You guys talked about earlier how drowning is really, drowning cardiac arrest is due to hypoxia. There's been a very, for both children, for adults, there's been a focus on hands-only CPR. But in this new update, you've talked a bit about airway breathing and circulation versus circulation airway breathing. When someone is extracted from the water and they need resuscitation, how should the layperson or a trained provider conceptualize how to do CPR to give these victims the best chance of surviving their drowning event?
Yeah, I mean, that's a great question, Alexis, and probably the subject that we spent the most time going back and forth on. I think here the balance that needs to be struck is between speed and then what's important to deliver in terms of resuscitation. So obviously, the faster you can resuscitate, the better it is. However, we know that airway and breathing are crucial. So if you can deliver rescue breaths quickly and effectively, then you want to make that the first thing you start with, right? And that really applies to trained rescuers, because learning how to do effective rescue breathing is not something you just pick up after being told quickly, go ahead and do it. This is also part of the reason why I think it's important to, get CPR training, actually practice on a mannequin, because we know that giving effective rescue breaths is not something that can be just done on the first go, but rather requires some practice. So if you are a trained rescuer, if you're able to deliver breaths effectively, that can be put first, and then compressions can begin. But if you're not so sure about that skill of delivering rescue breaths, then our advice is to prioritize compressions first, just so that you can get the resuscitation going. And in reality, the compressions do provide some degree of ventilation, although clearly not as effective as giving true breaths, and then move on with the breaths. So in either situation, both should be parts of your CPR, breathing as well as chest compressions. But depending on your training, you may want to prioritize airway and breathing, which differs a little bit from the standard basic life support recommendations at the moment.
Fantastic, thank you. I think that's a really notable difference and really important for rescuers to focus on. Before we move to the next section of our program, I just want to ask the audience to please put questions in the Q&A. Our second Q&A session will be using your questions, and Dr. Desfoulian and Dr. McCallum will be answering those. So if you have questions, get them in the chat. We look forward to answering them. So as we move ahead, Tracy is going to focus on the drowning chain of survival, which is a really important concept that was covered in this focus update. We know that most patients, or most drowning victims never move on to CPR, and that's why she's discussed prevention so far. And she will continue to focus on that in this next section.
Thank you, Alexis. The drowning chain of survival, as you mentioned, is a very important concept. And this differs from traditional chains of survival, such as the out-of-hospital cardiac arrest that people may be more familiar with. As you can see, the initial links really focus on prevention and rescue. So prevention, as Alexis mentioned, and I have begun speaking about, is vitally important to try to help prevent those drowning events from occurring in the first place. The second link I touched on a little bit in that Q&A session about recognizing distress and recognizing drowning and why that is so challenging. So really, making sure that there are people designated to watch that water, lifeguard at pool, and especially open water settings. And then there's a concept that we recommend on a water watcher, somebody who is designated to be within arm's reach of all children in or near the water. And there are water watcher tags that exist, which people can utilize to designate, I'm watching the water at this period of time, and really be that extra layer of protection on top of a lifeguard. The next links focus on rescue. And as Cameron mentioned, especially in potentially hazardous situations like in open water where there's waves, This really is important to do what you can, but if it is unsafe, calling for that help immediately, and relying on some of those specialized skills of the aquatic rescuers, such as lifeguards or trained rescuers. So providing flotation is one option if it's unsafe for you to enter the water. If there is something that you could potentially throw to the person drowning to help provide that temporizing way until the rescuers can arrive is definitely an option. And then when it is safe to do so, removing the person from the water, as we mentioned. And then the final link is the providing care as needed. So that would be what we're discussing with giving the CPR and resuscitating following drowning. But you can see there's 4 links that occur before we even get there. So a lot of good focus in this situation on the prevention and safe rescue. Some key points from the AAP policy statement and technical report that I mentioned. It is vitally important to take away the concept that there is no one way to prevent drowning, and it requires a multi-layered protection plan, so multiple layers that we can add on top of each other to prevent drowning. The evidence-based strategies, as I mentioned, the most evidence-based is the barriers, 4-sided around the pool. Supervision, I talked about with the water watcher and being close, constant, capable, making sure the water watcher is not distracted by using the phone, social media, any substance use if we're at a party and there's alcohol or other substances, making sure that person is really able to put their sole attention to the children in the water, and passing that on, sharing that responsibility so everyone can enjoy their gathering and their time with friends or family around the water, and also keep kids safe. Swim lessons are also important, and I'll touch on that a little bit later. Life jackets using a U.S. Coast Guard approved flotation device would be recommended for any weak or non-swimmers near the water, and always for everyone when boating. And then we've already talked extensively about CPR, and early bystander CPR is one of the most important factors that can impact the outcome or prognosis for drowning. So really important. The isolation fencing that I mentioned could be effective in reducing at least 50% of drownings in the highest risk age group, which is the 1 to 4 year children. Drowning is the largest cause or highest cause of death in that age group. So really preventing the unanticipated access to water for these children that are developmentally very curious and drawn to water is really important. There is a major change that occurred in this policy statement and technical report around swimming lessons. It was previously recommended that lessons start at the age of 4 years, and due to the evidence and literature, this was decreased to 1 year. So around the time when children are becoming much more mobile, the time when developmentally children are starting to walk, and as I mentioned, we'll be having more, risk of that access to the water. We recommend swim lessons start at that time. I also mentioned about lifeguards, and again, this is very important, especially in open water, but as a additional layer and not a substitute for parental supervision. This is something else that I wanted everyone to be aware of. So there is a U.S. National Water Safety Action Plan, and I was part of one of the working groups for this. There was a large number of national organizations and people within, mostly every state in the United States working together on this, a lot of aquatic professionals, and it was very exciting to bring everyone together to develop an action plan. There is a website here that you can see really, we're calling to action. Everyone can have change in their community, county and state, and then on a national level. So there are 6 different content areas that largely focus around those different layers of protection that I mentioned. And it's a really exciting opportunity and time for those of us who work in drowning prevention and seeing where we will move forward with this in the future. So with that, I will turn it back over to Alexis to moderate some questions from the audience.
Fantastic. Thanks, Tracy, for that focus on prevention. So we are really excited to dive into your questions. If you have more, keep them coming in the chat. I'll start with our first one, and Cameron, I'm going to target this to you. So the first question was, did I understand correctly that in drownings, rescue breaths should be given prior to the initiation of compressions?
So that's a great question, because this is probably one of the subjects that had the most back and forth within the group. And it's also something that is a bit different than the standard recommendation. So we created a 2B recommendation, which means it's an option. It's not something that we are strongly recommending, but it is an option that a trained rescuer can initiate resuscitation in cardiac arrest following drowning with rescue breaths. And the caveats to that, again, are that they are trained in how to deliver rescue breaths and that they can do it without delaying the overall resuscitation, which means putting off chest compressions for an extended period of time.
Fantastic. Thank you. So I think this next question is really important. We live in a post-COVID era, and we know that many of our guidelines changed with COVID. This question focuses on, during COVID, we stopped giving mouth to mouth. What would you tell someone who is not comfortable putting their mouth on a drowning victim? Should they stick with compressions? Will that help the patient or the victim at all? And Tracy, why don't you go ahead and take that question?
Thanks, Alexis. Yes, this particular focused update did not look at evidence or literature on COVID, so that was a little bit outside of the scope of what we evaluated. But in general, the recommendations are, protect the rescuer as well, keeping them safe. If this is someone outside of the rescuer's current household, and they don't feel comfortable giving mouth to mouth, as Cameron mentioned, if the rescuer is untrained, unwilling, or unable to provide rescue breaths, we do recommend giving compressions to at least do something to help provide that circulation to the body until help arrives, and then may have those protective devices such as a face shield, mouth-to-mouth barrier, or pocket mask that would allow them to safely give those rescue breaths. If it is someone within the rescuer's own household and they feel comfortable giving the mouth-to-mouth, then that would be recommended, since, as we mentioned, the rescue breaths are vitally important in resuscitation following drowning.
Yeah, I also think this is where equipment may come in. Going along with Tracy's point, if you feel like you're unwilling to do mouth to mouth, if you do have a pocket mask on you, and this may be, an impetus for some folks out there to get a pocket mask, just keep it with them. That's one way to provide effective breaths without putting yourself in danger. Some places, depending on the scenario, there may actually be a bag valve mask available or a pocket mask available within, a kit sitting at the pool side or something like that. So there are some options for bringing in equipment that can keep the rescuer safe. Again, as Tracy alluded to, in many cases of drowning, we're talking about family members or very close friends being the rescuer. And so in those situations, I think a lot of folks are willing to administer the breaths. To the best of our knowledge, if you're doing both, meaning giving breaths and CPR, that yields better outcomes. And so certainly if you're willing to give rescue breaths, we recommend it because that is associated with better outcomes.
Fantastic. Thanks to both of you for that answer. I want to transition a little bit, still focusing on rescue breathing. Another question that came is, should a professional rescuer trained as a lifeguard begin giving rescue breaths in the water? Cameron, why don't you take that first?
Yeah, I mean, I think that's a great question. And again, this is something where our recommendations are at the level of an option, a 2B. So we said that for trained rescuers, giving in water rescue breathing is in fact an option. We know that if you have a patient who is struggling to breathe and has not yet gotten to the point of cardiac arrest, that these can be effective and in fact can be associated with improved outcomes. But this really requires somebody who's trained, because most people who are in the act of drowning in the water are panicked. They're flailing around. They're not that easy to handle and to give rescue breaths to. So the person doing it really needs to have quite a bit of training to do it effectively and to not put themselves in danger. And so with that in mind, if you're one of those people, if you're a lifeguard or a trained water rescuer, then that may be an option for you. And it may in fact be a good one that helps the patient to prevent cardiac arrest and therefore have a good outcome.
Great, thanks for that answer. That was news to me when we started this update, so I really appreciate that understanding and clarity. Tracy, next two questions are for you. The first one is, post-witness drowning, is it better to put a drowning victim in the recovery position or giving abdominal thrusts in the absence of respiratory or cardiac arrest, with the goal of preventing respiratory or cardiac arrest from occurring?
That's a good question. Really, one risk that we do think about with a drowning event is the possibility for vomiting and aspiration of that vomit then into the airway or lungs. So if a person does appear to be breathing normally and has a pulse and is not in arrest, the recovery position would be recommended, so that that's basically with a side lying position and with the person's mouth kind of angled downward toward the ground. So if they were to vomit, that would come out and not potentially be something they would choke or aspirate on if they, for example, were to be placed on their backs.
Great. Thanks, Tracy.
And I think, was the second point about abdominal thrusts?
Yes.
Okay, so it's not recommended for that same reason with the risk of drowning to do abdominal thrusts post-drowning resuscitation. So again, that recovery position would be preferable, but avoiding those abdominal thrusts. That's an important point. So thank you to whoever raised that.
I want to shift gears a little bit. This is a scenario that as an ICU physician, I see not infrequently. So the concept of secondary drowning, dry drowning, I think we really struggle with these terms, but they are definitely used sort of in the community. When parents are thinking about a baby or toddler, and sometimes it's just, underwater very quickly pulled out, they are awake, they're alert. Sometimes 911 is called and the child looks good. Should they be bringing them to medical attention in that scenario, knowing that a small portion of these children may move on to having later respiratory distress? How should parents be thinking about this?
Thanks, Alexis. That is such a great question, and thank you to whoever raised that. There is a lot of misinformation and myth around secondary drowning and dry drowning. But there are really scary stories out there in the media and social media. So any parent like myself who is out there, seeing any of these stories or people posting on their Facebook or Instagram, it is terrifying. So I completely understand why parents come in really worried about this. What I can tell you is that secondary drowning or dry drowning, as Alexis described, this concern about drowning happening later on after the event, is not a recognized or accurate medical term or medical event. This makes it even more confusing because in the past, in some of the literature, those terms have been used. So it's very confusing for people to try to sort out. With our more recent literature and really focusing on looking at this area, what we know from emergency department literature is that patients who come in after a drowning event will deteriorate, which means if they're going to worsen, we see signs of that within the first couple of hours. So patients who came in with normal vital signs and normal exam initially, there were only 2 patients in this study that were looked at who initially appeared well and then got worse. And both of those patients did so within the first couple of hours. Some of those scary stories of a child, passing away maybe a few days or a week afterwards had later been found to be due to some other heart or lung condition not related to the drowning. So what I would recommend for families is if the child has a submersion event, they do go under the water, maybe come up and are, coughing or sputtering, and you're not sure and worried, that's what we're here for in the pediatric emergency department. So if you want to bring the child in, we can assess them, do their exam, look at their vital signs, and provide reassurance if those all look well. If the child did not, really get submerged, maybe just got a little face full of water and was kind of, a little bit coughing, maybe swallowed some water, that is, perfectly fine to continue to monitor that child at home. And if you were to notice any changes either in their respiratory status, which means if they were to start having a lot of coughing, if they look like they're breathing hard, breathing fast or heavy, or any change to their mental status. So they seem very sleepy, you can't really wake them up. Normally, those would be children that we want you to come and see us in the emergency department. And children who continue to look well can be reassured to keep those at home.
Fantastic, Tracy. So what I'm hearing from you is that it's the several hours after a submersion event that are probably where you need to watch the most closely. And then if there are changes in breathing or alertness, then presenting to medical attention is going to be really important.
Yes, that's correct.
Great. Okay, so I think this is a good opportunity for a little bit of clarification. We've gotten several questions around the trained versus the untrained rescuer. So Cameron, I think you had talked a little bit about that up front, but it's a confusing topic, especially with the healthcare professionals out there as well. So can you just explain again what is trained versus untrained? And then I think secondarily, the starting with rescue breaths followed by compressions, is that apply to the trained or the untrained rescuer? How do we conceptualize that for these 2 different populations?
Yeah, so great question. I mean, first of all, it's important to recognize that what we call trained is within our recommendations for that specific recommendation. It's whether or not you are trained to do that particular recommendation. So in other words, for something like in-water rescue breathing, if you are trained to do in-water rescue breathing, which for the most part applies to folks like lifeguards and other aquatic rescue workers, then you're considered trained. If you have basic life support training or advanced life support training, like someone like me who's a critical care physician, but you have no advanced water training, you're actually untrained in that setting. So the fact that you have a professional license or other training that's relevant to resuscitation isn't actually important when we're dealing with that particular recommendation. So that is true as you go through all of the recommendations that we have within these guidelines. Is really the question you should ask yourself is, are you trained on that specific role? So when we talk about rescue breathing, same thing. Are you trained to give rescue breaths? Have you taken a BLS course where you've practiced giving breaths on a mannequin, whether mouth to mouth or using bag valve mask ventilation so that you can do it effectively? If so, then you're considered a trained rescuer in that scenario. We do, in fact, recommend that trained rescuers in that situation deliver both rescue breaths and compressions because of the fact that those are associated with better outcomes than compression-only CPR. And again, we leave it as an option whether you want to begin with breaths or you want to begin with chest compressions. The question of what the ratios are really doesn't change. So in other words, in both pediatric and adult life support, a lone rescuer is advised to do 2 breaths for every 30 chest compressions, and we have not changed the basic life support recommendations. In the case of pediatrics, if there are 2 rescuers, that ratio shifts to 15-2, recognizing that children generally breathe more as a ratio of heart rate. And so again, you would follow those guidelines. But if you are untrained to deliver breaths, then you may use compression only CPR until someone who's trained to give breaths arrives and can do it for you. Hopefully that answers it.
I think it's really helpful for that clarity. It's a difficult concept, but I appreciate your answer. I think that is spot on. So here's another question related to breathing. If a person's lungs are full of water, will giving them breaths be difficult? Is there resistance as much as chest rise and to chest rise? And Tracy, maybe you can dive into answering that one for us.
Thanks, Alexis. That is another good question. So we do often see that with resuscitation following drowning, and there can be pulmonary edema or like fluid that does accumulate in the lungs and can make it harder to ventilate. So for giving the rescue breaths, especially when we have that equipment available with the bag valve mask and that trained rescuer, as Cameron mentioned, we often need to use higher levels of something we call PEEP, which is positive pressure, to be able to make good chest rise and to ventilate those lungs. So just, to be aware, if you don't have that special equipment, trying to get a good seal around the mouth as best as you can, and, giving as effective breaths as you can until additional help arrives. But that is often a challenge, and even later on in hospital care, if the patient does require to be on a ventilator or breathing machine.
Great, thank you so much. We're going to go to our last question for the session today before closing remarks. Cameron, this is for you, and it's a little bit of a tough one. Automatic external defibrillator devices. So you've touched on both PAD programs as well as the role of AEDs in the drowning victims. There's a question about if a homeowners association, a pool, wants to purchase an AED, how do they conceptualize putting that in place? And I think this ties to a little bit of a PAD program. What training should the residents have, and how should people conceptualize using that AED in a drowning event?
Yeah, great question. I mean, first of all, we definitely recommend that, if you have a homeowners association and there's some public places like a community pool, that you consider something like an AED, because again, that's a situation where you have many people and you have people doing exercise where cardiac events can definitely happen and lead to cardiac arrest. I think that the American Heart Association does provide an AED implementation guide, and so that's a resource you can turn to. In addition to that, the use of an AED is something that's reviewed within basic life support training, which is essentially CPR training. And so if you take that course, or if you provide that to members of your community, you're going to be providing AED training in effect. I will say that AEDs are meant to be something that can be implemented with no training, right? The AED, in fact, has the instructions right there on it on how to use it. And then the AED talks you through the steps of what to do in terms of analyzing the rhythm and then delivering a shock or doing compressions. And so the nice thing about an AED is it's meant to be essentially ready to go by any user who has the wherewithal just to grab it and place it on the chest. And so I think it's still a good idea, even if you don't have the ability to reach everybody in your community, even if you can't offer training, you can still put the AED there and get some utility out of it, in that people should recognize it and be able to use it in a situation where there's a cardiac arrest.
Fantastic, thank you. That is going to close out our Q&A. We've come to the end of our program. But we want to take a few moments to ask Tracy and Cameron what they'd like to sort of leave our audience members with some final remarks. Tracy, why don't we start with you?
Yes, this has been a great conversation today. We really appreciate all the engagement and questions from the audience and for all of you taking time to join us today. What I would recommend is look into swimming lessons, making sure that those in your family are trained in water competency, which includes basic swim survival skills. There are some really great resources out there for families. So the NDPA, National Drowning Prevention Alliance, has some amazing toolkits that they have put together. There are ones specific for parents, and they are with downloadable content. So they include a swim program checklist, which families can really walk through and try to evaluate what might be the best program for them and for their child. This other resource here is from Water Safety USA, and again, has a really nice guideline and checklist for parents and caregivers when selecting a swim program.
Thanks so much, Tracy. Cameron, any closing thoughts from you?
Well, I'm going to sound a little bit like a broken record, but I'm going to push CPR training, because I really think that what people need to recognize is that giving CPR, especially in a high stress situation where somebody is laying dead in front of you, is a tough thing to do if you've never done it before. And so getting some practice and implementing it is really important. And in addition to that, rescue breathing is not something that is trivial. So getting a good seal on mouth to mouth, or using a mask or a bag valve mask, it requires a little bit of practice. I think in this situation, thank God for the scenario in the Arias family where CPR training had recently occurred, right? And where they were able both to rescue the child out of the pool and then to quickly administer resuscitation. And so I think it really just illustrates how important this is, to have that as something that you kind of keep in the back of your mind and are ready to execute when the need arises. And you never know when that need will arise. So I think getting the training and maintaining your skills is something that really I would recommend for everybody.
Great, thank you. So I'm hearing prevention and training. We want to thank Lupe, Diana, and Kaylee, not only for being here today, but also for their courageous actions at the pool last summer, and the impact that they've had on a life. I wanted to thank Tracy and Cameron for covering their guidance. We hope you enjoyed this webinar today and found it to be helpful and insightful. Thank you so much for joining us.
Thank you so much for having us.